Hello, and thank you for tuning into Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people that are making it happen behind the scenes. I'm Dr. Bobbi Pritt, chair of the Division of Clinical Microbiology at Mayo Clinic in Rochester, Minnesota. And with me today is Dr. Bill Morice, the president and CEO of Mayo Clinic Laboratories. Hi, Bill. Welcome back.
Hey, well, it's good to be back.
Or should I say welcome back, because you're in Italy right now, right?
Yeah, I'm in transit back. So
okay.
I'm back virtually. I'm back on the podcast, but I'm not back geographically yet. Hopefully by the end of the day tomorrow I will be. Not that it's bad to be in Italy in June, don't get me wrong, but
yeah, I wouldn't complain about that. Well, you've been learning a lot, attending conferences on hematopathology, but also Mayo Clinic platform. So I think we have a lot of things to catch up on.
yeah, we do. And it was actually the European Hematology Association conference, which I attended, which is the equivalent of the ASH conference, the American Society for Hematology. But it's very much two things that really stood out there. First of all, it's gotten huge. The interest in just diagnostics is huge. It's 17,000 people. So it was at the major convention center in Milan. That's number one. Number two is just how much diagnostics are in the focus. And it wasn't just because of the meetings I was attending. I mean, the like things on minimal residual disease, and there were overflow rooms, and it's a lot of that too is because thoughts about how are AI going to power some of these decisions. There was a lot of discussion on AI and artificial intelligence and how it's going to augment the care of patients and selection of drugs and all these sorts of things. So yeah, it was a very interesting time.
Sure. It's really top of mind now, artificial intelligence and how it's going to really change a lot about how we practice, but how we really have to be using it conscientiously, ethically, and deliberately. And I'm glad that you were there attending that. I think all of us as laboratory leaders need to attend these conferences by our colleagues that are looking to lab data and want to apply AI to our lab data. It's, the patient's lab data, but we're the ones that are generating it, and we need to be a part of that process.
I completely agree. The other thing that's very interesting is to think about, again, it's really a global issue, and there are differences in terms of different parts of the globe and how they think about data for patients. Clearly, Europe and the European Data Protection, EU, I should say, data protection rights are very stringent. So it's interesting to be here and hear those discussions. So, but they're top of mind, I think, everywhere across the globe, particularly in developed countries, but probably everywhere, to tell you the truth.
Yeah. Well, let's talk a little bit about what's going on in the U.S. There was some news recently that the Joint Commission has partnered with a new organization called CHAI, which stands for Coalition for Health AI, to establish and implement evidence-based guidelines on using AI in healthcare organizations. And I think that this is really needed, some sort of partnership or some sort of guidelines on the ethical use of AI, something that could be applied across healthcare.
I completely agree, and that's kind of why I mentioned, and the European approach is, of course, it's I don't want to say pro-regulatory, but they put in a regulatory framework. I mean, it's clearly the U.S. and the current administration is moving in a different direction. And even prior to the change in administration, I think we were just by our very nature, our country tends to have a more of a lighter touch on regulation in general, which means it really isn't incumbent on us because healthcare is all about trust. So to your point, that really means that we have to hold ourselves and know all of us in our profession to a very high standard, such that patients can trust us and trust the tools that are being bought to improve their care.
Absolutely. And here at Mayo Clinic, we're doing a lot of exciting, using powerful tools, a lot of exciting things with AI that's really going to improve care for patients. I was very pleased to see that Mayo really is putting that emphasis on the ethical use of AI. And of course, AI is being applied to the Mayo Clinic platform. So maybe we should talk about that a little, because I didn't get to go to the meeting recently, but I think you were there, right?
Yeah, I was. I had the chance to attend, and it's yeah, and it really was exciting this year because it seems like a lot of things that were either conceptual or were kind of in small stage pilots, if you will, are now becoming much more scaled and mainstream, and with a real, and now trying to understand just how much can some of these tools really impact our ability to care for patients in a positive way, right? So it was very exciting. to see that. Still a bit daunting as well for different reasons in terms of just the pace at which things are accelerating with large language models and other things, but other things, excuse me. But I think that the platform conference this year was much more focused, I think, rightfully so, on things that are actually happening in healthcare through the use of AI. And that, of course, AI has to be an artificial intelligence, and large language models have to be applied to data sets that power them, right? And that's really what Mayo Clinic Platform has been about, is providing access to the data and the tools that can turn the data into answers, right?
Mm-hmm. Yeah, we've talked about platform in the past, and it could be this rather nebulous term if you don't really understand what it is. And you read about virtual platform models in healthcare, and it's really this technology-enabled framework that can connect different groups, patients, providers, payers, stakeholders. And the Mayo Clinic platform is really taking data in a de-identified safe way and making it available to use tools to help gather insights. So you can say, does my current patient have a disease that has an outcome like other people that are in this platform? And how can I learn from this to treat my patient better? So it could be a little dense when you're first starting to learn about platform.
Yeah, no, and I think I'm not an informatician by training, or data scientist or computer programmer. And so I think the other challenge with the term platform is it actually it has different kind of applications or different meanings in the same context. So on the one hand, it's exactly what you and I have talked about before, and that is, connecting different people, or in some cases customers like Amazon, but different people that need something or a service with someone that's able to provide that service, right? And so that and forming that connection without requiring a physical space.
Mm-hmm.
And of course, that's so needed in healthcare because there's such a need for access to healthcare and disparities in access. And that's one of the real promises with platform and that approach to healthcare, is it can help get more people to the healthcare providers that they need, that will help improve or maintain their health. The other piece of that, though, is all that is powered by, as you say, by data. So the other way that we think about platform, like Mayo Clinic Platform, it is making those connections in healthcare. It's also providing the data that helps power the insights that fuel those connections, to your point. And so the other thing that's been very forward-looking from Mayo Clinic, without being too self-serving, is recognizing that our data is great, but it's still a small slice of all the healthcare data that's out there. So they've been working hard to create these federated data networks so that everyone's
Mm-hmm.
data is private, but yet we can make an insight in Mayo Clinic's experience and see, does that apply to the Missouri area? Does it apply to another part of the world like Singapore? So that's when it really starts to become, we really start to see the effects amplified.
Yeah. So what did you learn from the platform conference, and what were your big takeaways?
I guess a couple. I think on the good side, more and more, Mayo was one of the organizations that was kind of out in front of this. And when you're out in front, that means there's not as many opportunities to collaborate. I think now it's very pervasive. I mean, it seems like most healthcare organizations in the U.S. and in many parts of the world are thinking about this whole platform approach as a way to grow access and to grow knowledge and make knowledge more accessible. I think that's and so that's is great. I think on the flip side are the whole topic of terms that I don't fully understand. I'll be honest, things like agentic AI and
Oh, yeah.
agents, but essentially where you can now have programs which you give it a task and it goes off and does it, right? And so thinking about how do we use those, how do we, they have great power, but also then how we getting back to your point with chai and everything else, how can we make sure they're being used responsibly? Because I have to say, I'm traveling with Dr. Chris Garcia, who is, of course, one of our Mayo Clinic DLMP and Mayo Collaborative Services informaticians, and very bright guy in these areas. And he was at the conference as well. And I said, it's kind of funny, because you hear some of the speakers talking about some of these agentic AI programs that actually talk to each other. And then they would say at the end, well, but don't worry, it's not going to be like Terminator or something like that. And it's like, well, I don't know. If you got computer programs that you just tell it to do something and it goes and does it like your butler, and then it starts
Mm-hmm.
talking to other butlers. Yeah, I think that. So I think it just means that we don't have to be informaticians, but we have to really understand how these tools are being used, and where, again, as we've talked about multiple times, as laboratorians, what's the data being used, and what's the appropriate question to answer from that data, and where would it work and where would it not work, because that's obviously kind of a blind spot for some of these tools.
Yeah, it really brings up some great points. We understand in the laboratory how maybe a certain chemistry works or technology, but we probably couldn't build it ourselves. I certainly couldn't build the computer or the headset even that I'm using right now, but I have the general gist of how it works. And I think that's going to be important for AI, but you get into some AI systems and they become increasingly black boxes. So
Yeah.
then you ask yourself, well, what's important to know? And perhaps it's more important to know how it was trained and on what data set. Was it only trained on Caucasian middle-aged men and therefore maybe might not be applicable to my patient population? That would be helpful information.
Yeah, I think that's right, and I think, or just knowing enough to question, you know,
Right.
and ask that question if it doesn't seem right. I think that's, of all the things, honestly, the Terminator things that probably, hopefully we can build in safeguards to that. But I think probably um, more insidious, if you will, or a little more difficult to put your finger on, but that we have to watch for is just that we start to, lose critical thinking skills. And I see you as, and I had the privilege to be the DLMP chair, and the privilege to have you as serving as our vice chair of education,
Mhm.
thinking about how do we actually educate trainees, right? Because they talk about knowledge being a commodity now, and which is something that you and I would never have thought of at all. You're always worried about data being a commodity, but with some of these learning algorithms, it's like, is knowledge a commodity? And so it's like, it is if we give up the high ground of actual critical thinking, right? So I think that's, and we have to educate, train our trainees how to use these tools. We have to train our practicing physicians and pathologists and laboratorians how to use these tools. But really, it's going fast. But we're gonna have to rethink a lot of things. But
Mhm.
really keeping the whole, our profession, and the fact that we need to serve patients first and foremost at the foreground.
Yeah, well, when I was reading a little bit more about the Mayo Clinic platform, I was really pleased to see that Mayo Clinic platform has a digital Hippocratic oath. And of course, we've all taken a version of the Hippocratic oath when we graduated, for those of us that are medical doctors, graduated medical school. And it's really doing no harm, upholding the principles of autonomy, beneficence, justice. And that's exactly what the platform digital Hippocratic oath is. We have to think about ethics with these new tools that are so powerful but come with these risks.
Yeah, it's funny. It's not funny, but it's so true. It's like,
Hmm.
look, the tools might change, but we as the individuals have to be grounded on the same core values, right?
Yes.
And for us, it's our Franciscan values. And whether you take the Hippocratic Oath, or if you're in healthcare in the laboratory in any way, shape, or form, you're driven by the desire to help patients. And so I think keeping those values at the forefront. If we do that, then we won't have any of the missteps that some of these tools could create, right?
Hmm. Yes, for all of us at Mayo, we have our rich ties values, respect, integrity, compassion, healing, and these are things that apply to all of us.
Yep. And
And
then,
I think
and
all of us that are in healthcare, we're here for the patient.
totally agree. And I mean, that's, of course, that goes back. It goes back to the Franciscan nuns when they were, but it's so it's even more. It's those. I mean, it's just part of the human condition to have those values and to uphold them if you're in healthcare. And of course, two of those are things that can really be aided by this, and that is innovation and excellence, right?
Hmm.
There's no doubt that these tools will, and the innovation that's driving them will improve the quality of care if they're done correctly. And so it's our job to understand them and to make sure those use cases are correct. So it's an exciting time. It's a little
It
daunting,
is.
but it's exciting.
Well, I have to say that I am waiting for my agentic AI digital butler to do all these tasks for me and, set up my hair care appointment and maybe my teeth cleaning. And, I think that would be pretty slick.
Yeah, that probably would. My closest agent right now are Hattie and Gretzky, and they don't do anything
They
that I,
don't do that for you?
they're
No.
entertainment. They're my agentic entertainment. And they're very spontaneous. So I have to worry about them. They have their biases, but it's mostly choice.
Yeah, basically treat driven. You could,
Yeah,
bribe them with treats.
treats and attention.
Well, thanks for the great overview, Bill, and I'm sure we'll be talking about this again in the future, being a hot topic.
I'm sure we will. In fact, if we're not, we're probably missing something, because it's clearly going to be a big issue here for the rest of this year and for the years to come. So.
Yeah. Well, safe travels home from Italy. Your reservation wasn't made by AI, was it?
No, not that I'm aware of.
So hopefully you'll make it back, and I'll see you when you get back here.
Hopefully I will.
All right. Thanks,
Bye.
Bill. Bye. Thank you for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and tune in every other Thursday for new episodes.